1. Welcome to today's deep dive into one of medicine's most underrated diagnostic tools, urinalysis. Whether you're a med student, clinician, or just curious, this test reveals more than you might expect. 2. Urinalysis is a laboratory examination of urine that provides insights into a person's metabolics, renal, and systemic health. It's quick, non-invasive, and incredibly informative. 3. The test is typically broken down into three main components: physical examination, chemical analysis, and microscopic evaluation. Each tells a different part of the story. 3. Let's start with physical examination. This involves observing the urine's color, clarity, and odor. These simple characteristics can offer immediate clues. 5. Normal urine is pale yellow and clear. Darker shades may suggest dehydration, while red or brown hues could indicate blood, hemoglobin, or myoglobin. 6. Cloudy urine might point to the presence of pus, crystals, or bacteria. A strong, sweet odor could be a sign of uncontrolled diabetes due to ketone bodies. 7. Next up is the chemical analysis, often performed using a dipstick. This strip contains pads that change color based on the presence of specific substances. 8. The dipstick tests for pH, specific gravity, protein, glucose, ketones, bilirubin, urobilinogen, nitrites, leukocytoesteres, and blood. Each has clinical significance. 9. Urine pH reflects acid-base balance. A low pH may suggest acidosis, while a high pH could indicate infection or renal tubular acidosis. 10. Specific gravity measures urine concentration. Low values suggest overhydration or renal impairment. High values may indicate dehydration or glycosuria. 11. Protein in urine, especially albumin, is a hallmark of kidney damage. Persistent proteinuria often warrants further nephrological evaluation. 12. Glucose in urine is abnormal and usually points to diabetes mellitus. It appears when blood glucose exceeds the renal threshold, 100 IC/mL. 13. Ketones are byproducts of fat metabolism. Their presence may indicate diabetic ketoacidosis, starvation, or a low-carb diet. 14. Bilirubin and urobilinogen are liver-related markers. Elevated levels can suggest hepatocellular damage or biliary obstruction. 15. Nitrites and leukocyte esterase are indicators of urinary tract infections. Nitrites result from bacterial conversion of nitrates, while esterase signals white blood cells. Blood in urine can be due to trauma, infection, stones, or malignancy. Dipsticks detect hemoglobin, which may come from intact RBCs or lysed cells. 17. Now let's zoom in, literally, with microscopic examination. This involves centrifuging the urine and analyzing the sediment under a microscope. 18. Microscopy can reveal red and white blood cells, epithelial cells, bacteria, yeast, crystals, and casts. Each finding adds diagnostic depth. 19. RBCs suggest bleeding within the urinary tract. WBCs point to infection or inflammation. Squamous epithelial cells may indicate contamination. 20. Casts are cylindrical structures formed in renal tubules. Hyaline casts are benign, but granular, RBC, or WBC casts often signal pathology. 21. Crystals vary by type: calcium oxalate, stones, uric acid, gout, and struvite infection. Their presence can guide metabolic evaluations. 22. Bacteria and yeast under the microscope confirm infection. However, culture is needed to identify the organism and guide treatment. 23. Urinalysis is used to diagnose UTIs, monitor diabetes, detect kidney disease, assess liver function, and even screen for pregnancy-related complications. 24. On social media, you can break this content into bite-sized posts, one analyte per reel, carousel, or infographic. Use visuals, mnemonics, and clinical pearls. To my thing, in summary, urinalysis is a diagnostic powerhouse. It's simple, fast, and packed with information. So next time you see a urine sample, remember, it's more than just waste. It's a window into the body.